Breast cancer awareness is crucial. Learn about the signs and symptoms of breast cancer in this informative video. Early detection can make all the difference in the world. In this video, we dive deep into the important topic of breast cancer, providing essential information about its signs and symptoms that every person should be aware of. Knowledge is power, and being informed can help save lives. What you'll discover in this video. 1. Common signs and symptoms of breast cancer. 2. The importance of regular screenings and mammograms. 3. Tips on reducing breast cancer risk through a healthy lifestyle. 4. How to perform a breast self-exam. Number 1. Common signs and symptoms of breast cancer. Common signs and symptoms of breast cancer can vary from person to person, and some individuals may experience no symptoms at all. However, it's essential to be aware of the following common indicators. Lump in the breast. The most common symptom is the presence of a lump or thickening in the breast tissue. This lump may feel different from the surrounding breast tissue and can be painless or painful. Changes in breast size or shape. Any noticeable changes in the size or shape of one breast compared to the other, or changes in the contour of the breast, could be a sign of breast cancer. Unexplained breast pain. While breast pain is often not associated with breast cancer, unexplained or persistent pain in the breast or nipple should be evaluated by a healthcare provider. Nipple changes. Look out for any changes in the nipple, such as redness, scaling, crusting, or a nipple that turns inward, inversion. Nipple discharge. Spontaneous nipple discharge that may be bloody, clear, or another color should be examined by a doctor. Skin changes. Changes in the skin of the breast, such as dimpling, resembling an orange peel, redness, or puckering, can be indicative of underlying breast cancer. Swelling in the breast or underarm. Swelling or enlargement of the breast or the lymph nodes under the arm can be a sign that breast cancer has spread. Unexplained weight loss. Sudden, unexplained weight loss can sometimes be associated with more advanced breast cancer. Breast skin or areola changes. Changes in the appearance of the skin on the breast or areola, such as peeling, flaking, or thickening, should be investigated. Persistent breast itch. An unrelenting itch in the breast, not associated with any other obvious causes, should be evaluated. It's important to note that these symptoms can also be related to non-cancerous conditions, and not every breast lump is cancerous. However, if you experience any of these symptoms or notice any changes in your breast health, it's essential to consult a healthcare professional for a thorough evaluation. Early detection and timely medical attention can significantly improve the outcome in cases of breast cancer. Regular breast self-exams and mammograms as recommended by your healthcare provider are essential for early detection and prevention. Number 2. The importance of regular screenings and mammograms. Regular screenings and mammograms play a critical role in breast cancer prevention, early detection, and treatment. Here are some key reasons why they are so important. Early detection saves lives. Breast cancer is most treatable when detected at an early stage. Mammograms can detect small tumors that may not be felt during a physical exam. Detecting cancer early increases the chances of successful treatment and survival. Increased survival rates. Studies have shown that women who undergo regular mammograms are more likely to survive breast cancer if it is diagnosed. Early detection often means less aggressive treatment and better outcomes. Detecting abnormalities before symptoms appear. Breast cancer does not always cause noticeable symptoms in its early stages. Mammograms can detect abnormalities, including small tumors or precancerous lesions, before any symptoms occur. Monitoring high-risk individuals. For individuals with a family history of breast cancer or other risk factors, regular screenings and mammograms are crucial for close monitoring and early intervention if necessary. Less invasive treatment. When breast cancer is detected at an early stage, treatment options are often less invasive. This can lead to shorter recovery times, fewer side effects, and a better quality of life during and after treatment. Reducing mortality. Screening programs and mammography have been associated with a decrease in breast cancer mortality rates in many countries. Routine screenings can help catch cancer at a stage when it is more treatable, reducing the risk of death from breast cancer. Peace of mind. Regular breast screenings provide peace of mind for individuals, knowing that they are actively monitoring their breast health. This can reduce anxiety and fear associated with the uncertainty of cancer. Educational opportunity. Screening programs often provide educational materials and guidance on breast self-exams and breast health, empowering individuals to take an active role in their well-being. Cost-effective. Early detection through screenings and mammograms is generally less expensive than treating advanced-stage breast cancer. It can also reduce the financial and emotional burden on patients and their families. Supporting ongoing research. Data from screening programs and mammography can contribute to ongoing research efforts to improve breast cancer detection, treatment, and prevention. It's important to follow the recommended screening guidelines provided by healthcare professionals. For most women, regular mammograms are recommended starting at age 40 or earlier if they have a family history of breast cancer or other risk factors. However, the timing and frequency of screenings may vary based on individual risk factors and healthcare guidelines. In summary, regular screenings and mammograms are essential tools in the fight against breast cancer, offering the best chance for early detection and successful treatment. Number 3. Tips on reducing breast cancer risk through a healthy lifestyle. Reducing the risk of breast cancer through a healthy lifestyle is an empowering step you can take to protect your well-being. While there's no surefire way to prevent breast cancer, adopting healthy habits can significantly lower your risk. Here are some tips. Maintain a healthy weight. Excess body weight, particularly after menopause, has been linked to an increased risk of breast cancer. Aim to maintain a healthy weight through a balanced diet and regular physical activity. Eat a balanced diet. A diet rich in fruits, vegetables, whole grains, and lean protein sources can help reduce cancer risk. Limit the consumption of processed foods, red meat, and sugary beverages. Stay physically active. Regular physical activity can help lower the risk of breast cancer. Aim for at least 150 minutes of moderate intensity exercise or 75 minutes of vigorous intensity exercise per week. Breastfeed if possible. If you have the opportunity and choice, consider breastfeeding. Breastfeeding may have a protective effect against breast cancer. Regular screenings. As mentioned earlier, regular breast cancer screenings and mammograms are crucial for early detection. Follow the recommended screening guidelines based on your age and risk factors. Breast self-exams. Familiarize yourself with your breasts through regular self-exams. While self-exams are not a substitute for mammograms, they can help you become familiar with your breast tissue and notice any changes. Stress management. Chronic stress may weaken the immune system and potentially impact cancer risk. Incorporate stress reduction techniques like mindfulness, meditation, or yoga into your daily routine. Sleep well. Prioritize getting enough quality sleep, as poor sleep patterns have been linked to an increased risk of breast cancer. Remember that genetics also play a role in breast cancer risk, so even if you adopt a healthy lifestyle, it's essential to continue with regular screenings and healthcare checkups. A combination of a healthy lifestyle and early detection can greatly reduce your risk of developing breast cancer and improve your overall well-being. Always consult with your healthcare provider for personalized advice and guidance based on your individual risk factors. Number 4. How to perform a breast self-exam. Performing a breast self-exam, BSE, is a simple yet valuable skill for early detection of breast abnormalities, including potential signs of breast cancer. Here's a step-by-step guide on how to perform a breast self-exam. Step 1. Preparation. Choose a convenient time, ideally a few days after your menstrual period when your breasts are less likely to be tender or swollen. If you no longer menstruate, choose a specific day each month for consistency. Find a well-lit, comfortable place to conduct the exam, such as a bathroom or bedroom. Step 2. Visual inspection. Stand or sit in front of a mirror with your arms relaxed at your sides. Examine your breasts visually. Look for any changes in size, shape, or contour. Observe for skin dimpling, puckering, or redness. Check the nipples for any discharge or changes in direction, e.g., inversion. Raise your arms overhead and observe your breasts from different angles. Step 3. Self-examination while standing. Keep your hands on your hips. Press your hands together to tense the chest muscles. Examine your breasts in a circular pattern using the pads of your 3 middle fingers, index, middle, and ring fingers. Start at the outer edge of the breast and move inwards, using light, medium, and firm pressure in a circular motion. Cover the entire breast area, including the nipple and the surrounding tissue. Make sure to examine both breasts and compare them to each other. Note any differences in texture, lumps, or areas of tenderness. Step 4. Self-examination while lying down. Lie down on your back with a small pillow or folded towel under your right shoulder. Place your right arm behind your head. Use the same circular motion with your fingers to examine your right breast. Examine the entire breast, moving from the outer edge to the nipple, just as you did while standing. Switch to your left side and repeat the examination on your left breast. Step 5. Check for nipple discharge. Gently squeeze each nipple to check for any unusual discharge. A small amount of clear or milky fluid may be normal, but if you notice blood or any other type of discharge, consult a healthcare provider. Step 6. Repeat regularly. Perform this self-exam every month on the same day to become familiar with the normal feel and appearance of your breasts. If you notice any changes, consult a healthcare provider promptly, even if you're not sure whether the change is significant. Remember that most breast lumps or changes are not cancerous, but it's crucial to report any unusual findings to a healthcare professional for evaluation. Regular breast self-exams, combined with clinical breast exams by a healthcare provider and mammograms as recommended, contribute to early breast cancer detection, which can significantly improve the chances of successful treatment. Breast cancer can affect anyone, regardless of gender, and it's crucial to be proactive in monitoring your breast health. Share this video with your loved ones to spread awareness and empower everyone to take charge of their health. Join us in the fight against breast cancer by watching, sharing, and subscribing. Together, we can make a difference and help save lives.